Hi everybody, my name is Kristina. I'm the nurse practitioner here at Maia Plastic Surgery. Welcome to Maia's patient portal. We've created some videos for you to help prepare for your upcoming surgeries. So hopefully this will help prepare you for any questions you may have. And then we will attach some paperwork with more detailed instructions. So an upper and lower blepharoplasty is skin removal from the upper eyelid or the lower eyelid. Sometimes it also includes removing fat pockets as well. If you're only having an upper blepharoplasty, that's something that we can do in the office under a local anesthesia. You're wide awake. We just give you some medication to make you feel calm and relaxed, and then you go home right after the procedure. If you are doing a lower blepharoplasty, that does require general anesthesia. So we take you to an outpatient general anesthesia surgical center. It's the same day procedure. You go home the same day. Both procedures are minimal pain. We do expect bruising and swelling to last anywhere up to 2 weeks. And then most people after 2 weeks are ready to go back to work. We can barely tell that they had anything done. Post-op care that's specific to the blepharoplasty procedures is typically we want you icing your eyes. If you're having other procedures such as a facelift, neck lift, fat grafting, we typically do not suggest icing. But the eyes for the blepharoplasty is one place you can ice. You want to ice for about 20 minutes at a time. You can do it as often as once an hour for the first 1 to 3 days. Your swelling will get worse up until 3 days post-op before it starts to get better. So icing those first 3 days is crucial. Another thing that's specific to the blepharoplasty is we really want you using eye drops and eye ointment at night. The reason for this is that your eyes can swell when you're healing, and because of that, it can prevent your eyes from closing all the way, which could cause eye dryness. So you want you using an over-the-counter eye drop such as Systane or Refresh as often as needed throughout the days when you're recovering. And then at nighttime, you can use an over-the-counter eye ointment, same thing as Systane Refresh PM, and use that when you're sleeping. The reason you use the ointment when you're sleeping is because it can cause some mild blurry vision. Another thing with the blepharoplasty is that we only want you using Aquaphor along your incision line. So wherever you see sutures around your eyes, you do a thin layer of Aquaphor, and you do that twice a day. You'll notice if you're having any other procedures with us, we do recommend doing Bacitracin for the first 3 days and then switch to Aquaphor after that. The eyes are different because if you get Bacitracin in your eyes, it can burn and sting and be really uncomfortable. So absolutely no Bacitracin around your eyes, only Aquaphor, in addition to the eye drops and the eye ointment at night.